Hi everyone and welcome to my video blog and today we're going to be talking about Candida. Now Candida is often misconstrued with just being like vaginal Candida or yeast problems, but this is something that can live in the whole of the body and can also affect the body in a number of ways, not just a vaginal yeast infection. So what is Candida? So Candida is an overgrowth of yeast and bacteria, bad bacteria in the body. There's elements of obviously bacteria that we do need in order to help our digestion and also help absorption in the gut of our key nutrients. But there's also, from a number of reasons, there could be that overgrown bacteria which can cause a leaky gut, causes the Candida to leak into the body, and the yeast can build up around different organs in the body. So it's really it's one of these things that I think is overlooked quite a lot, and I find that because there's a number of symptoms, a lot of people will look at just treating the individual symptoms, whereas if you can kind of peel the layers back and look at the core of the problem, you can get a lot better results. So I think it's really important when you're seeing your clients to start probing them for different symptoms and start seeing if there could be a potential link with Candida, because I personally find about 6 out of 10 people will suffer with Candida or a form of Candida. Okay, so if we're looking at different symptoms, they can range from things like digestive problems to fungal nail infections to skin allergies, eczema, acne, general allergies, food intolerances, again really key. Basically what it can cause is your immune system to overreact, so anything in the forms of autoimmune diseases such as fibromyalgia, ME, chronic fatigue. So and there's also other things like sugar cravings. People often tend that they need sugar because the Candida feeds off of sugar in the body. So if you find that you have clients that are actually suffering from a number of these issues, like I say, it might be worth looking and probing a little bit more to see if they could be potentially suffering with Candida. So I would start probing in the consultation phase. So ask your client lots of questions, see if they're suffering with any of these symptoms, and then start asking them a little bit more detail. For example, how much alcohol do they consume? Because obviously there's yeast that's in alcohol that can cause Candida, the overgrowth of yeast in the body. Is it that they have a highly stressful lifestyle, again causing the body to overreact? Is it that they've had a long course of antibiotics, again because this strips the body of all the good bacteria, allowing that yeast and that Candida to overgrow in the body? Is it that they've got a lot of carbohydrates or yeast in their diet, like bread for example? So if you're finding that your clients are suffering with the symptoms, like I say, ask these probing questions to find out if if there's something in their diet or in the lifestyle that they could be potentially changing that could help this. And again, it's all about education, helping the client to feel educated on different conditions that are out there. Like I say, not just treating a nail fungal infection, actually treating the core of a problem. So yeah, I mean, I've had really great results once I've done different changes in people's diets. There's a lot of different advice out there, so I don't want to bombard you in this blog post. All I want you to do is start probing your clients and start finding out, actually, could anyone be potentially suffering with Candida? I think it's a really key condition to look at. So yeah, get probing, get asking, and then in the next blog post we'll go over different treatments that you can help with Candida. Enjoy! Bye!